Hello everyone, this is Dr. Priya Singh and welcome to New Roots Hair Clinic. In our last video, we discussed about what is the maximum age to get hair transplantation. In this video, we'll talk about what is the minimum age to get hair transplantation. Well, there is no definite or legal age to get hair transplantation, but one needs to be extra cautious for all the patients who are below the age of 25 for obvious reasons. Nowadays, 1 in 5 men suffer from hair loss before they reach their 20s. We have seen many typical male pattern baldness of 5 or 6 grade cases at the age of 18, and the donor also appears to be in the verge of extinct. The male pattern baldness is caused by a hormone called dihydrotestosterone, commonly known as DHT. So what this hormone does is it stimulates the hormone receptors which are present at the root of your hair, and it triggers hair loss. Younger patients may handle this situation a little differently than older patients because it really affects their mind, their self-confidence and their self-esteem. So this is the reason they go for hair transplant as their first option of treatment. Now, hair transplant at younger age is very difficult to tackle, as what kind of hair loss and balding pattern they may get in future is very unpredictable. That can lead to the loss of donor area also. Many patients get transplant in early ages in hairline unless it's stable and face bald patches later in their mid-scalp or vertex or crown, giving it again a patch look which may look unpleasant and unnatural than before. The important thing here is to note that donor area is limited and one has to use it very cautiously. If you are having transplant at a younger age and you have exhausted the donor area, you may not have enough to go for a redo surgery again in future. This is the reason that one should not see hair transplant as their first option in their early 20s. What they should do is they should rather choose to stabilize the progression of male pattern baldness with lifestyle modification, taking DHT blockers and using topical minoxidil and using alternative therapies like PRP. Once they have reached a certain age and they have stabilized the progression of hair fall, then they can go for hair transplantation. Then not only it will give a very good result, the life and the duration of the transplant also improves. The advice that I would like to give young patients is that please meet your hair doctor who will give you honest opinion regarding your donor area, your age and what treatment you should go for. Here in New Roots Hair Clinic, it is always possible to achieve great results without having to go for transplantation through medications or alternative therapies. With this, I would like to end today's video and I'll come again with another topic. Till then, please take care.